Hey everyone, welcome back to the Dr. Greg Jones Optimization Academy. In today's episode, we're going to dive into VO₂ Max and why it's being called the gold standard for longevity. And we'll also talk about what it tells us about your health span and how improving VO₂ Max can cut your mortality risk in half. We're going to explore cutting edge strategies, including how metabolic testing, targeted peptides, and functional fitness are revolutionizing the way we approach health optimization and longevity. My guest today, returning to the show, is Leonard Pastrana, a pharmacist and longevity expert who's redefining what it means to practice modern medicine. Leonard began his career in the traditional pharmacy world, but after witnessing firsthand how medications were being used as band-aids rather than solutions and his own health journey, he knew there had to be a better way. That search led him to cellular medicine, performance science, and ultimately to co-founding New BioAge, a wellness network rooted in longevity and precision health. So whether you're a seasoned athlete or just trying to age with grace and energy, this conversation will completely shift how you think about fitness, aging, and the future of personalized medicine and longevity. Let's get into it. All right, Leonard, welcome back to the show, man.
Thanks, man. Thanks for having me.
I know this is what, our third time doing it?
I think it's our second time. It's actually been it's been a little while.
Yeah. We did one back in the day on GLPs for sure. Man, was that the only one? I guess that was the only one.
Yeah.
I'm right, dude. I'm at a point now.
Waiting for your phone call. Where you been?
Dude, I've done like 70 of these damn things, man. At this point, I'm like, have you been on here before? I feel like we've done this before, but it's good. And I appreciate the time, man. So, and this time we're going to talk a little bit about background, man. I think I've become a better host now. I actually want to know more about you to just hopping into the science, man. And I used to just hop into it. No gas. No brakes, all gas. But so, and we talked about this, man, just kind of hanging out at different conferences, but you started your career off as a retail pharmacist. And then you got out of that life and got into functional medicine and peptides and longevity. And then you guys started New BioAge. What led you down this path?
Yeah, I think the same thing that a lot of providers have the similar story was I started off in retail. I hated it, of course. I was just kind of like pumping out prescriptions as fast as I can. And just kind of felt like a dead end and didn't really feel like I was helping anybody. And I started working in a hospital, which was a little bit better. I felt like I was using more of my clinical brain. But even there, what got me to kind of change gears was my own health. And this happens to a lot of providers. It was my own health. I was gaining a lot of weight. I had a lot of reoccurring injuries. I didn't have any energy, and I was in my mid 30s, out of breath, walking up the staircase. And I started just doing my own research and trying to figure out, how can I be better? How can I feel better? Really looking up to different entrepreneurs that had done really special things in their lives, and they constantly were talking about, longevity and optimization, or talk about medicine in a different way. And that's what led me down to a different path of just trying to take care of myself. And somewhere along the way, I ended up in a peptide certification course that just kind of changed my entire outlook. I left traditional medicine and started my own business doing other things in prescriptions and helping people save money on prescriptions. But it wasn't until I came back to a peptide certification course where I realized, wow, medicine can be something completely different than what I was used to or traditionally trained. It was some amazing providers, some of our friends that are friends now, like Dr. Yurth and Dr. Suzanne Faree were teaching this peptide certification course, and they were talking about exercise and nutrition and fasting, but they were doing it in a clinical way. And they were talking about this thing called peptides, and it just kind of blew my mind and just opened up, completely changed my career. And so it was a fun path, but it started off with me just trying to help myself.
Yeah. I think it happens with a lot of people, man. We get our own health together, and you start, then you start with your family, then it's like, hey, I want to make a career out of this. And it changes the way we look at medicine and the way we look at prescribing, the way we look at just health in general. And so, man, I'm glad you found the path, man. And it's funny because I think we both kind of started around the same time. I know we talked about this, man, where it's like I think we're about to speak at a conference, and it's like, dude, I've been doing this shit for like a year, and kind of the same thing. It's crazy that we're talking on stage, and so much has grown since then. Now, a good segue, man. You kind of mentioned some of the longevity and some of the practitioners that become friends and colleagues and everything like that. And so you guys at New BioAge, you developed a clinical applications of medicine, right? So kind of a clinical longevity program and training.
Mm.
And so I definitely want to give you some time a little bit later to talk more about that.
Yeah.
But recently, you guys just held a longevity summit or clinical longevity summit focusing on long COVID. And that is a fascinating topic on itself. And tell me more about the event, man. How did it go and what are some of the highlights of it?
Well, the event was amazing. I was a little nervous about that. We know that for a long time we couldn't really talk about COVID, and we finally felt that, hey, I think the time has passed, times have changed, and we can actually start talking about this more in public. And we are an organization that's based on the clinical application of longevity medicine, and we know that if you're seeing patients now, that they've all been impacted by COVID. Everybody's been impacted by spike protein in some way. And I don't know if you've noticed this, but we have noticed it, and many other providers have noticed that patients are just, are aging faster. We're seeing younger and younger people complaining about brain fog, younger and younger people having cardiovascular issues, having anxiety issues, all lasting impact of COVID. And so we wanted to have a conference that was about longevity. How do we help patients in this post-COVID era? Not necessarily even long COVID, right? When people think of long COVID, they think of somebody that has a very rare disease, that has a lot of fatigue, that can barely do anything. It's a spectrum, right? Everybody's been impacted by COVID, and a lot of the providers are seeing that. And so we brought in specialists from everywhere, cardiologists, pediatricians. We brought in some of the researchers that from Italy. They were doing some diagnostics tests where we can actually identify if you still have spike protein in your blood, if you have spike protein from a vaccine or spike protein from the actual virus, and just kind of bringing everybody together to understand what's the root cause of a lot of this accelerated aging and what we can do about it. And so it was an amazing weekend. We had so much fun. Everybody kind of sharing their stories, going over protocols, going over patient cases. And it was amazing. And really how we ended the conference was, a lot of times we can get these patients back to baseline, but how do we build resilience? Because so often they get back to baseline and they exercise too hard, they get in an airplane, they get a cold, and they're back at square one. And so the conversation finished with, how do we build that resilience? How do we build that mitochondrial resilience? And really, how do we continue this conversation into next year, which is the clinical application of longevity medicine. So it was a ton of fun.
Oh, good. I'm awesome, man.
Yeah.
I couldn't make it, man. I wanted to, but I ended up speaking in Mexico. So
that looked really cool. That screen that you were behind, I remember sending you a message. That was,
dude,
they seemed like they put on a nice show.
Man, dude, like the production value was Oscar worthy, dude. That's all I can tell you about that, man. The screen was like an LED screen. I felt like it was like 30, 40 feet long, 20 feet high. And it's cool to walk back and point to my slide. Like, I'm talking about this right here.
Yeah. No, it looked great.
No, thanks, man. Yeah, I was like, man, I wanted to share more with you. Like, man, can we get this next year? Dude?
This is how we do it. I'm scared to ask how much that cost.
No, yeah, I know. Therein lies the problem, right? Nothing is free. Nothing is free.
Yep.
And they had, a lot of people there from different countries, man. So they had translators there. It was wild, man. It's a good experience. So, but yeah, man, we're going to talk about VO₂ Max today and really longevity, which is a good, I know this is a big focus of what you guys are doing down there. And VO₂ Max, has been, whether you've heard of, at some point in the last 2 years, most people have heard of VO₂ Max, right? Could have been in the last 10, 15 minutes, and it's gained more traction and longevity, and more clinics were testing for it. Even this ring is claiming it tests for VO₂ Max. We're going to talk about how legit that is. But for those who are unfamiliar with the term and what it does, what exactly is VO₂ Max?
Sure. So VO₂ max is the maximum amount of oxygen that your body can utilize, right? And it's measured in liters of oxygen per kilogram per minute. And it's basically as simple as you want to describe it, is how well your body can utilize oxygen. And so VO₂ max is this integrator. It's this integrator of your cardiovascular system, your muscular system, your respiratory system. All these need to really be working together to see how well you can utilize oxygen. So VO₂ max is a great marker that we use. Clinically, we love it because we can point to a lot of literature. But the way that we test for it is something called metabolic breath analysis. And people are obsessed with VO₂ max, and we can talk a lot about VO₂ max. But what I find really interesting clinically for us, and even for some of the patients out there, is all the other metrics that we get along when you're looking at a VO₂ max. So we can look at things like fat oxidation rates. We can look at people's resting metabolic rate. We can look at their mitochondrial function, how well they're utilizing fat oxidation versus carbohydrate oxidation. We can look at their fat max. We can look at how efficient they're moving. We can look at their respiratory rate, and we can identify any limitations. They might have a limitation when it comes to the respiratory system, or a limitation when it comes to a cardio limitation. And so there's so much great data that we can get to use and how we kind of personalize treatment and how we can actually prescribe exercise. And VO2 max is just the end integrator of all those things. Basically, that final number that tells us how the entire system as a whole is working.
Okay. So, man, Leonard, I love my analogies, man. And when I think about VO2 max, I think about a sports car, right? Or their body being the sports car. And from my understanding of VO2 max, there's three components of it, right? There's how much oxygen you can actually get into the lungs,
Mhm.
then how much of the oxygen gets into circulation, so the cardiopulmonary side of the house, and how is that oxygen utilized by the muscles and different systems in the body. So for me, the way I think about it, and correct me if I'm wrong, is that basically the first part about the oxygen is how much fuel can you get in the tank, right? How much,
Mhm.
is it a small gas tank? Is it a large gas tank? How much fuel can it hold? Then the second piece is how that fuel gets out of the gas tank and into the engine itself. And the third part is how the engine utilizes that oxygen, right? So it doesn't matter if you have a tank full of gas and a great system. If you can't go more than 10 miles an hour, you're just kind of
Mhm.
wasting that fuel, right? And so
Yeah.
is that kind of a good way to look at it, or is there some nuances to it? I know I'm being very basic and generic with it, but just
Yeah.
understanding how our body uses VO2 max.
No, I think that's a great analogy, and the way you're describing it is you're basically saying, hey, all of these systems matter, right? I remember when I was taking a VO2 max test the other day, and I was really trying to get a higher number, and I have this coach that we can talk about that does amazing things when it comes to respiratory therapy. And I remember I was at the end, I was at the peak, and I wanted a really high VO2 max, and so I was just going as hard as I can, and I was breathing at 50 breaths per minute because when he saw my results, he was like, "What?" He's like, what were you doing?" I was like, "I was trying to like suck in as much oxygen so that my VO2 max can go up." And he's like, "You're actually shooting yourself in the foot because you're hyperventilating and you're blowing out CO2, and so you're not going to have that oxygen absorption that we're looking for." And so it's you can't cheat it. It's how the entire system is working as a whole, which is what you described in your car analogy, engine analogy.
Okay. Oh, hey man, I guess I got that one right, man. I literally just, honestly, I just made that one on the spot, and I just kind of was
Well,
like,
if
let me
anybody can make up
give it a
analogies, it's you.
on the spot. Like,
You
this
always
can go
break
really
into
good
analogies.
or really bad, man. It's just how I like
Mm,
to, explain things. Now, I'm glad you mentioned that working with your coach
mhm,
and the trainer or specialist is like the testing of VO2 max, because
mhm.
my understanding there is the active test and then there's a stationary test, and there's pros and cons to each. And then last but not least, there's other apps out there claiming to test VO2 max. Like my Aura Ring has, I walk around the block for 6 minutes and it's supposed to tell me my VO2 max, which is limited in itself, and for different
Yeah,
reasons. But let's talk about what are the differences between the stationary and active tests and then some of the health trackers, what they're giving you.
sure. Yeah, so usually you have a resting test, right? And this is going to tell you cellular efficiency, right? So you're seeing how well your body is utilizing oxygen at rest. You're basically measuring aerobic metabolism. You're measuring how well the body utilizes oxygen to break down substrates like fats and carbohydrates for energy, right? And so what we get, some of the great markers that we get from a resting test are something like your RMR. Now, this isn't typically your RMR is your resting metabolic rate, basically your energy expenditure, how much energy you're expending to just basically sit and breathe. And this is a very important marker. And some people think that they have this marker because we get an RMR. Like if you get on an in-body, or if you give someone your age, height, weight, sex, they can tell you what your RMR is, but that's a calculation, right? Especially with a lot of like the rings and stuff. That's your calculated RMR, and it's typically close. What's different about doing an actual RMR is that we get your actual versus your calculated. And so we're actually looking at your energy expenditure, what's actually happening. Why this is so important is because we take a look at what your calculated rate is, right? And if your actual is above that, we know that your metabolism is good. It's sped up, or it's working well. If your actual is below your calculated, we know you have a slowing down of metabolism. This becomes very important in patients when it comes to things like GLP-1s, right? GLP-1s, sometimes patients caloric restrict too much. They lose a little bit of muscle mass, and we see that energy expenditure going down. And then this is where the patients have it's harder for them, or they're more prone to weight regain, or it's harder for them to lose weight. And so this is a really great marker where we can get like a baseline understanding so that as they're losing weight or losing or gaining muscle, we can make sure that their metabolism isn't slowing down. This data is also amazing for people that have, like, let's say, a nutritionist in-house. Because you can make a calculation on how many calories you think somebody needs, but you can actually see what their actual energy expenditure is, and you can get very personalized with that. So that's at rest. That's showing us basically energy expenditure. I would say is the greatest tool there. Now, once you start moving your body, it's a little bit different, and we can actually take a look at mitochondrial function on this one. So what we do is they put the breath analyzer on, and they get on a treadmill, and they're walking slow at first, then every minute we kind of pick it up, and we do a test for about 12 minutes. And so there, it's measuring the amount of oxygen coming in, the amount of CO2 coming out, and we get all these different biomarkers from that. The most interesting ones are fat oxidation and carbohydrate oxidation. So as someone's walking very slowly, they're oxidizing a bunch of fat. But as we speed that up, carbohydrates kind of take over. And so this gives us a direct measure or an indirect measurement of mitochondrial function, because fat is oxidized in the mitochondria. And so we know that it's a marker of efficiency. So if carbohydrates are taking over really early and it kind of crosses over, we know that their mitochondrial function is not as efficient. We also get to see how much fat they're oxidizing, at what heart rate, at what wattage. So we get to see their efficiency. And so this gives us tons of details when it comes to how we prescribe exercise or how we measure some of the interventions that we're doing. If we're using peptides, if we're using supplements, we can measure from one day to the next, did we make a change? Right. And so, and that's what we're looking at, because we can tell somebody, hey, you're oxidizing the most amount of fat at a 2% incline at, 105 beats per minute. And we can say, hey, for 45 minutes a week, 45 minutes, we want you to walk at 105 beats per minute. And we know they're oxidizing the most amount of fat there. So we can really, really personalize exercise. And then on the top end of that is where we see the VO₂ max. It's where we see the different zones of training, and we get all other types of data. But that's the main difference between resting and an active test. But we get so much data where we can really personalize treatment from those two.
Okay. So I want to circle back to that, because one of the things that we see a lot, especially with the Apple Watch and the rings and all that, is about these zones of training. Zone 1 to zone 5. Is there a zone 6? Stop at 5. I believe
it's typically 5, but if you get into like Olympic athletes, they go up to level
they get a little higher.
Zone 7. Yeah, they have different things that they look at.
Yeah, they don't even bother putting that on the watch. They know the typical person is going to get there, right? It's like, let's not even waste your time. So if I'm hearing you right, it's that data that can tell you, like, hey, because most people want to know how much time they should spend in that zone of training, like per day or per session. If I'm hearing correctly, the VO₂ max, the data you're getting from that, can give you that information to know what zones you're going to be more optimal in, or is that a different metric?
So a VO₂ max test gives you a VO₂ max. It's really a metabolic breath analysis test. And so before you get to VO₂ max happens when you're in zone 5. So once you get that test, it'll give you all the zones. The VO₂ max is that last thing. It's making you kind of run to exhaustion, because we're trying to see, remember the definition of VO₂ max, how much oxygen your body can actually utilize. So we bring someone to almost the point of exhaustion to see how much are they actually able to put inside.
Okay. So is there so there are places that are doing the stationary tests. You're not going to get the VO₂ max from that. Is that true? Because is it more of an estimate? And again, I just want to make sure I'm clear on this, because you're not running, you're not on a bike, you're stationary, and it's going to give you data, but it's not the same. I'm hearing you right.
Right. So there's all types of extrapolations. There's all types of formulas, right? So they look at, hey, if you can run a mile in X amount of time. So those are all calculations, kind of similar to the RMR. It's calculated, but there's nothing like the actual test, right? So think about what we're measuring. We're measuring how well your body can utilize oxygen. How is a ring going to possibly do that, right? How is doing anything stationary going to possibly do that? I run these tests. We have a longevity assessment center where we run metabolic breath analysis tests and body composition tests every day, all day. And I can tell you, even from measuring myself and testing different devices, it is never anywhere close to the actual measurement of VO₂ max. It's just, it's the difference between one of those scales that you buy for $30. It's telling you how much fat tissue you have versus getting on a DEXA scan. Like, you can see the trend. Maybe it'll show that you're getting better. But as for accurate data, no, it's not even close. And if you're using it as a clinician to actually personalize exercise or make decisions based on your treatment plans, you need to use metabolic breath analysis because it's not good enough.
Gotcha. So in preparing for our episode and like looking at some of even the studies out there, they're relating VO2 max as a new gold standard for longevity, which is fascinating because VO2 max, apparently they were able to measure this shit in the 1930s, right? So it's not a new concept, right? It's just how we're
Right.
using it, right? So why is VO2 max a new or kind of updated gold standard for longevity?
Yeah, you're right. We were using metabolic breath analysis, or not we, but they were using it 100
Yeah.
years ago to calculate the nutritional needs of human beings, right? And so it's not. You're right. It's not new data. What changed? I think two things. One, we got literature that was so compelling that you couldn't look away, and it wasn't that recent. It was some time ago. The second thing is that I think patients started demanding something different out of medicine. Where we were in that sick care model where we're waiting for something to happen, where patients were more demanding, hey, I want to get ahead of things. I want to know how well I'm doing. I want to know how I can prevent or delay the onset of chronic disease. I want to know how I can be optimized, have the most amount of energy now. And so they started demanding more of that. And clinicians started, your patient base went from patients not only that were sick, but patients that were pre-disease, but wanted to see how they can perform at their best. And so I think those are the main two things. But clinically, it was some of the papers that were done that showed us that VO2 max, or improving someone's VO2 max, was just as good or maybe even better when it came to mortality risk as things like smoking, diabetes, coronary artery disease. I mean, some pretty incredible, compelling studies that came out when it comes to predicting mortality risk.
Okay. That's wild. Yeah. And the data I saw, they had this monotonic relationship. It was literally linear. It was like the better your VO2 max was, the lower the all cause mortality risk was. And it was
Yeah.
pretty even. It wasn't like it was very obvious that there's a gap there, right? And so, but one of the things that I found fascinating is the biggest gap was between, and it kind of broken into different categories. I think it was like 4 or 5 categories where there was low fitness, which was the bottom 25th percentile. This is like sedentary, I don't work out, I just chill on the couch kind of thing. And then everyone above them, but that first gap into below average, we're talking about really low, super low to below average, it was almost like a 50% reduction in mortality just from that small gap, which was
Yeah.
fascinating, right? So and where I'm kind of going with this is that why are more people not doing this?
Yeah, I see. So we started talking about that study a few years ago, where we were like, because you have this gap between VO2 max was typically something that was tested in like Olympic athletes. Like this metabolic breath analysis was more for professional sports. It was done in cycling, Tour de France. That's where these tests were done. It was more a performance based world. But when I saw that study, I was like, well, this is the one study that bridges both these worlds. Because when you look at that study, what they did was they looked at hazard ratios of some of the most common diseases we know. So when we're like, as a medical provider, when you're trying to analyze risk or mortality risk, you're thinking of things like, hey, I know if you start smoking, that you have, your hazard ratio is 1.4. You have a 40% increased chance of mortality. If someone comes in and they have diabetes, I think it's 1.29. If someone comes in, if they have coronary artery disease, it's something similar. If someone comes in and they have end-stage renal disease, we know that mortality-wise, that they're at much greater risk. And so where this study bridged the gap was they said, okay, watch this. Watch what happens. Watch what the difference is, like you said, between somebody that has very low VO2 max, low cardiorespiratory fitness, and if they were to get to below average, look at the hazard ratio there. And so the hazard ratio, like what you were describing, is someone's low compared to someone that has below average. They're not even good, they're below average. The hazard ratio change is 1.4. It's the same as smoking. It's the same or even higher than diabetes, right? And so what was interesting about that study was it wasn't just for patients that had low cardiorespiratory fitness. It's for patients that had high cardiorespiratory fitness. Because the question is, you have patients that come in, they're seemingly healthy, but they want to be the best version of themselves, or they want to start preventing, or they're interested in longevity medicine. Well, can we make a difference in those patients? Well, they found that if you have above average VO2 max and you go to just like the high, you have a change in hazard ratio of 1.4, right? So it's almost as significant as someone smoking. And even if someone has high VO2 max, if it goes from high VO2 max to elite, you still make a substantial change in the mortality risk. So it's not even for patients that have low cardiorespiratory fitness, but everybody can benefit from an increase in VO2 max. And if we think about what's actually happening, it's your body's ability to utilize oxygen. And this marker is coming from how well your muscles are working, how well it's looking at your blood, it's looking at your cardiovascular system, it's looking at your respiratory system, and it's integrating all of those into this one number. So it makes sense that if we're doing that well, that we're improving health span and lifespan. And so I think that was the one study that finally got both sides to kind of understand. The exercise side was like, yeah, we've been telling you guys this for a long time. And then the medical side was, okay, I can engage in this world because you're talking to me about hazard ratios. You're talking to me about mortality risk. You're talking to me about the risk of diabetes. You're speaking my language and you're showing me the data that this is really, truly making a difference. And so now the question is, how do we help people to get from low to below average? Or how do we get people to improve their VO2 max and their cardiorespiratory fitness? And that's with all the things that you do on a day-to-day basis.
Okay. Man, that's a good segue here, man. Just because one thing that you find is that VO2 max, it inevitably is gonna decline with age. And I think the study I saw, like 10% per decade after 30 years old. So, once you hit 50, 60, it decreases. So we know it declines with age, but what are some of the kind of myths or misconceptions you hear about this decline? Is it, because I've read some studies that are like, like it's inevitable, can't do anything about it. Is it different between, elite athletes and more of your everyday person? What are we getting wrong about the decline in VO2 max?
Well, it's multifactorial, of course, right? So I'm turning 45 this year, and I plan on my VO2 max being higher next year than it is today, just by the things that I'll be doing. So you can absolutely train this, right? And especially in your 30s, 40s, 50s, even 60s, you still have the ability to train this. So if my advice to someone that's young is to try to get as high a VO2 max as you can, because age will eventually catch up. So you want a good baseline. But can you make a significant difference? Absolutely. And it's different from everybody. We see patients that come in that are seemingly they haven't made the best lifestyle decisions, but maybe they exercised a lot early on in life. And we'll see that they have, biological, they're like 69 years old. They have a biological age of 54 because their VO2 max is a little bit better. But this is something that we can work on. Now, a great example of what you're describing also is we had VO2 max data on patients pre-COVID. Right? Pre-COVID versus post-COVID. And so this is one of the things that we see in our post-COVID patients is that they have exercise fatigue, right? So you have, post-viral issues, you have exercise fatigue, exercise intolerance. And so we have specific case studies. Someone came in, they have a VO2 max of 45. They got COVID, they had the chronic lung infections, they had the same issues that everybody had, never really feeling like they recovered. They're seemingly healthy patients. Their blood work is fine. They feel like they're not exercising the way they used to. They come back for another test to dial things in, and now their VO2 max has decreased by 30%. Their fat oxidation rates have decreased, right? But we can't see it on their blood, but we know their mitochondria had taken a big hit. And so we've had, patients like that where within 3 to 4 months, we can actually change and get them back to baseline by prescribing exercise, working on their zone 2, doing interval training, as long as they're not, some long COVID patients, you have to do things a little bit differently and slower. But we can we see it all the time in patients in their 30s, 40s, 50s, their VO2 max going up. So like anything else, we can, you have control over this. You can definitely exercise your way into better mitochondrial function if you do it correctly.
Good. And that was literally my next question. And we're going to get into, let's just say the person's done their test. It's like, hey, I have a suboptimal VO2 max. Now we have to do something about it. And so I want to start with the exercise or the physiological adaptations from training to improve VO2 max. So how can we improve VO2 max with exercise? Is there a particular type of exercise? Is there like a minimum effective dose of exercise? Like, where does that person start when they get the, hey, my VO2 max kind of sucks right now?
Yeah. So there's standard ways of increasing VO2 max, right? There's been studies showing what increases VO2 max the best, but I'll take it one step further and I'll say that with anything in clinical longevity medicine, it needs to be personalized, right? It really depends on that person in front of you. So if that person in front of me, if they have metabolic syndrome and they're overweight and they don't have a history of exercising, if I do all the tricks and I give them zone 2 and I give them interval training at zone 4 and 5 and I do high intensity interval training, I know their mitochondrial function is not working well. I know that they're going to try to create ATP and they're going to cause all this oxidative stress. They're not going to recover from exercise and we're not going to necessarily get anywhere, right? So it really depends on where the spectrum that patient is at. So in patients that have that metabolic syndrome or have any type of autoimmunity or situations like that, we're really going to focus on zone 2 because the literature, the clinical studies show us that what the impact of zone 2 training on the mitochondria. It actually improves mitochondrial density, not necessarily new mitochondria, but mitochondrial density. It improves fat oxidation. It improves the electron transport chain. We can actually have an impact on the size of mitochondria and how well it's functioning. So we'll work on that first. And once they get to a certain spot, then we'll do the zone 4 and the zone 5 higher intensity interval training or interval training that also increases VO2 max. But I'll give you one perfect example. The professional athletes that train for the Tour de France, if you ask their trainers how much time they spend in zone 2, they'll say 80% of their training is in zone 2, which you would imagine they were doing higher level intensity things, right? But creating that mitochondrial base is so important. Now, if somebody is a little bit more optimized, they're used to exercising, we're going to dial in zone 4 and zone 5 training to have more adaptations at those higher levels. And so it's really personalized. What I'm looking at is how consistent can they exercise, and how can we help them exercise better? And so this is where peptides become so instrumental. It's how well can you exercise in the moment, but also how well can you recover from that exercise, right? Because recovery and sleep is going to make a big impact. So I'm really thinking about what supplements, what peptides can we utilize so that their actual exercise is better and the recovery is good too. And that's where we've seen the biggest increases in VO2 max.
That's great. One thing I saw, and when I think VO2 max, before we started prepping for this interview, is I always think about cardio and endurance training. So your high intensity interval training, your zone 2 cardio. But some of the studies I read actually showed that muscle and resistance training had a big impact as well. And it made sense, right? Because if you're doing resistance training, you're actually activating those muscle satellite stem cells. You're getting more mitochondrial biogenesis. You're getting more mitochondria in the muscle. And that's going to improve that oxygen extraction. And that's going to contribute to improve VO2 max. That was the first thing I saw. But interesting enough, it said also you get more perfusion, more capillary supply to the muscles as well. And that shifts them to more of an oxidative kind of fiber, right? So they're trying to use more of the fat oxidation, and that extracts more oxygen out. And so it kind of, again, when you think VO2 max, we think about the guy sprinting on the treadmill with the mask on, but there's benefit to actual strength training and actually, lifting weights, which was kind of surprising to me as well.
Yeah, no, you brought up such a great point, because you described it beautifully, like how well your muscles can utilize oxygen. That's what's so great about a metabolic breath analysis test, is because it shows you where the limitation is. So many times people come on and they didn't even get out of breath. We didn't get them to exhaustion. Their thighs were burning because they didn't have the muscle capacity to pedal. If they're doing, sometimes we do it on a treadmill, sometimes we do it on the bike. And so we know it's a muscular limitation. And so that's what's amazing about VO2 max. You can't hide from it, right? If you have a muscular limitation, if you need to get stronger, if you need to do more resistance training, it's going to show up. If it's a cardiovascular issue, if it's a respiratory issue, it's going to show up. So yeah, absolutely. Resistance training is very crucial to what you're doing, because remember, it's about efficiency. It's liters per kilogram as well too. So even fluctuations in weight are going to change that. So you have to kind of work on everything simultaneously.
That's it. Gotta lift, man. Gotta lift, bro. That's it.
You gotta lift weights. Can't get away from it.
Do you even lift? Do people still say? I remember that was the thing. Some social media stuff. It'd be some guys like, just running all the time. Do you even lift, bro? So I think it's important. It's not just about
Yeah.
that piece of it. And we know lifting weights and strength training and resistance training is a longevity factor, right? In many ways as
Yeah,
well.
absolutely.
So you're known for
Mm,
lecturing. This is one of the ways I met you, for lecturing on peptides and
mhm,
longevity, and not just peptides, but also supplements as well that optimize metabolism and athletic performance. How do
mhm,
some of these compounds work synergistically with exercise to improve VO2 max? A better way to ask that, Leonard, is there
mm,
how do peptides improve VO2 max, or can
mhm.
they?
Sure. So the way I look at peptides might be a little bit different. Sometimes people look at, like, let's say, growth hormone peptides because it's going to increase muscle, or you're going to maybe have more endurance. What I'm looking at is how well they exercise in the moment and how well they recover from that exercise. Right. And so when it comes to peptides, yeah, there's mitochondrial peptides that are going to make an impact, directly on one of those workouts. But it depends on what we're working on, right? We're trying to mimic exercise or help with things that converge on those same pathways. So if you think about something like a growth hormone peptide, it improves lipolysis, it improves fat oxidation, it also improves recovery. If we think of things like BPC 157, that helps tendons and muscles, and it also improves growth hormone receptor density, so they're going to recover from exercise even better. If we have a patient where they have a low fat oxidation, or carbohydrates are taking over, and we think that there's a mitochondrial dysfunction, supplements like Leucinergy that mimic exercise, that work on those same exercise mimetic pathways that stimulate, our fancy words like PGC1 alpha, that stimulates fat oxidation. So things like Leucinergy. If we're talking about energy production, if you can go back into your biochemistry days and think about the Krebs cycle, right? Think about the intermediates inside the Krebs cycle. The Krebs cycle is what gives the electron carriers necessary for the electron transport chain to have oxidative phosphorylation and ATP. Well, one of those intermediates of the Krebs cycle is alpha-ketoglutarate, right? And alpha-ketoglutarate is a great supplement that we can absolutely use. We know that when someone starts exercising, those Krebs cycle intermediates like alpha-ketoglutarate, they go up by 4 to 5x. So alpha-ketoglutarate is a huge one. How well they exercise, things like just something as simple as hydration, right? We use something called iCell water that has creatine and amino acids, so that patients are hydrated and they have good cell volume to protect against protein degradation. How well they're exercising in the moment and how well they're recovering from exercise. So I would say there's two ways of thinking about it. One is converging on pathways that mimic exercise when it comes to fat oxidation, mitochondrial things. And then there's the recovery from exercise, like growth hormone peptides, BPC 157. They're going to help them exercise even better the next time. And it's really in finding the right combination for patients depending on what you're trying to do. Because remember, VO2 max is going to be improved by how well they exercise. And so that's how peptides help VO2 max. It's not helping VO2 max directly. You're not, outside of maybe like MOTS-C or something like that, you're not gonna make a big difference 30 minutes before doing that test. It's gonna completely be about how well and how consistent they exercise and how they recover from that exercise. And peptides have everything to do with that, and that's what increases that VO2 max number.
Okay. So everything that you just said led me to two questions. First
Mm.
one, for those who are not familiar with New Bio, is what's Leucinergy?
Yeah. So Leucinergy is a really interesting supplement. There was a lot of research done back in the day on NAD. It continues to be on NAD, right? And so typically people talk about NAD precursors, or how we're going to raise NAD. The science behind Leucinergy was based on low dose leucine, and what they found with that is that they can decrease the amount of NAD needed to activate sirtuins. And sirtuins are, people call them like longevity, proteins, but what they're really doing is that, and one of the more important things about NAD is that NAD is required for sirtuins to activate all the gene transcription factors, all the things that they're in control of. And so when we think about what happens in our body when we exercise, well, we stimulate things like PGC1 alpha and fat oxidation. We inhibit inflammatory cytokines like TNF alpha. We upregulate antioxidant enzymes. So these are all the positive benefits of exercise. A lot of those are stimulated by sirtuin activation, and you cannot activate sirtuins without NAD. And so there was this really interesting research done on low doses of leucine with other co-activating compounds that decreases the amount of NAD you need to stimulate all these exercise mimetic pathways. And so if we're working on somebody that we want to mimic exercise or we want to improve fat oxidation, we use something like Leucinergy that has low doses of leucine and these other co-activating compounds. It's kind of like a little mini exercise mimetic. So we're always doing that when it comes to weight loss. Most of the providers we work with almost always when they use GLP-1s or they're trying to improve weight loss, they'll use something like Leucinergy.
Okay. And the second piece is, I know we've been looking at this streak going one way is like, hey, use resistance training, cardio, kind of your interval training, zone 2 up to zone 5 training to improve VO2 max. Does improving VO2 max improve athletic performance and strength and endurance? Is it a bidirectional kind of interface there?
Well, that's an interesting question. When you get to the higher levels of competitive sports, they actually found that the best people winning the Tour de France didn't necessarily always have the highest VO2 max. But that's in professional sports. But some of the things that you can think about when it comes to VO2 max is remember you have improved cardiorespiratory fitness. You improve the way you utilize oxygen. So where you feel that is when you're walking up the stairs, the energy that you have. Cognitive function, your memory, your recall, your ability to utilize oxygen. If you think about all the other therapies that are out there, there's like hyperbarics, there's there's so many things around breath and improving oxygen. We're all trying to do the same thing. VO2 max is what you're actually capable of on a day-to-day basis. So you'll feel it on your day-to-day. You'll feel it in how well your brain works. You'll feel it in how well you can exercise. Because if we, the greatest tool that we have outside of all these peptides, everything is exercise, I believe. And when you have an increase in VO2 max, you exercise better. I think of exercise as a medication. You're enhancing the medication that you have when you have an increased VO2 max.
Okay. Awesome. And last one on the supplement side of the house, we mentioned kind of those 3 prongs of VO2 max, getting the oxygen to the body, using it by the muscle. One of the supplements, class of supplements we hear a lot about are nitric oxide kind of enhancers or precursors and all that. I know alpha-ketoglutarate has some ability with that as well. Is there a role for nitric oxide in improving VO2 max?
Well, I don't have any data showing that it necessarily does. It'd be hard to say that, not necessarily even nitric oxide supplements, but the nitric oxide doesn't play a very significant role in VO2 max and exercise and performance and blood flow and oxygen and nutrient delivery. Honestly, one of the things that people don't mention a lot about when it comes to BPC is its ability to improve nitric oxide. So outside of even improving growth hormones and recovery, that's another advantage to it. One of the potential disadvantages is that things that are popular, like methylene blue, have a negative impact sometimes on nitric oxide. So those are some things to look out for. But nitric oxide, I think, is really tricky. The body is always trying to get to homeostasis, right? And so it's changing so quickly. So it's a little hard to measure, but of course it plays a significant impact. I don't see how it could hurt at all.
Gotcha. So what role do you see VO2 max and metabolic testing playing in the future of longevity medicine?
So I think it's the future of longevity medicine. I think in the future, you're going to go for a longevity assessment and you'll get your typical blood work and the other things that happen. But I think everybody will have a baseline VO2 max. Everybody will know their zones. Everybody will know their resting metabolic rate because this is all about longitudinal data. It's not just the data we get that day, but it's how are the peptides we're using? How are the lifestyle modifications that we're doing? How are people changing? When we retest and we reanalyze, I think it'll be the standard of care in the future. I mean, I don't see why not when it's such a big indicator of mortality risk, and it is such a baseline for how our mitochondria is working and how our not only our health span now, but our lifespan in the future. And I think it'll be how we make decisions clinically. And I think the tests will get better and better and more accurate. And I think it'll be a key thing that we're looking at when we're making decisions on how we're putting longevity plans together.
When I was prepping for the episode, man, I saw the American Heart Association actually strongly recommends getting a VO2 max or at least a cardiorespiratory fitness test done with routine visits. I don't think that's happening yet. but at least they recognize the importance of it. So I haven't heard of anyone's like, yeah, I went to go get my routine physical. Next thing you know, I was on a treadmill. I haven't seen that yet.
Yeah, no, I mean, we're trying to do it. We have a longevity assessment center. We're trying to work with doctors locally in West Palm Beach if they want to send their patients over to us to get the data so they can make better decisions. The American Heart Association said something about it. That's great. But the American Heart Association also showed up to say that we still need Coca-Cola and potato chips as part of a certain plans, so
No, yeah. Take
the
that with
American Heart
a grain of
Association,
salt. No pun,
yeah,
pun intended. Take that with a grain of salt.
yeah,
Yeah,
they show up in different places with
yeah,
different
no.
recommendations.
Oh my gosh, man. I know, man. Before I let you get out of here, man, tell me a little bit about some things you got coming up in the future, man. I know I saw you guys just announced a big event in next February, Calm 2026. Can you tell us about that?
Yeah, absolutely. It's the clinical application of longevity medicine. This is specifically for medical providers focused on clinical longevity medicine. We believe that the majority of the industry is typically trying to bypass the medical provider and go directly to the consumer. And we see this from businesses to technology to assessments to pharmaceutical companies, finding ways to bypass the provider and go directly to the consumer. And we want to create a place for providers to come because we think that medical providers are the ones that should be leading the charge when it comes to not longevity medicine, but the clinical application of longevity medicine. And so this is a 2-day event where we fly in some of the best speakers, including yourself, to talk about what's actually working. Looking at anything from cardiologists to pediatricians to exercise scientists to understanding more about the conversation we had today. What are the protocols that people are using? What are the different compounds that are using? What type of the ecosystem of what type of lab assessments are we doing? What type of other companies are some of the best providers using to deliver longevity medicine? And really, that's how we end that conference. Is that we are all about not just education and what you can utilize, but how do you actually deliver that medication, that longevity medicine? What companies do you use? How do you educate your other staff? How do you scale more practitioners so you can make a bigger impact? So there's going to be a lot of clinical education, but there's going to be a lot about how do you actually deliver that to your patients. And so we're super excited, and we're planning for that every day. It's going to be a lot of fun.
All right, good. Did you say I was speaking? I
Of
didn't.
course
So
you're speaking.
was that an invite? I don't know, man. Like,
Of course you're speaking. Of
look,
course you're
man.
speaking. How can we not
After,
have?
so like I
How can we
said,
not have you there?
I don't know, man. If you don't have an 800-foot LED screen, man, I don't know, Leonard, man. I've
I
got
know you're too big time now. I saw you there, and I'm like, oh, now he's going to be a prima donna. He's going to
no,
want the
no,
big
exactly.
screen.
I'm gonna need a big screen. I need to have at least 3 or 4 translators there. There's some Spanish speaking people in that audience, man. I need to make sure we're set up for that and all that. No, I'm excited, man. No, I love the
Yeah.
event, and it's just the energy of being around some great speakers, and the audience is great, and people are there to actually learn and what can they apply and practice. And it was such a good time last year, man. I'm looking forward to it. And I believe we're doing Fort Lauderdale this year.
Yeah, Fort Lauderdale at the Omni Hotel. It's a brand new hotel. They actually just finished making it. It's right on the water. It's gonna be a lot of fun. And I think you said the main part. There's something around being around other like-minded people. Sometimes when you're practicing this type of medicine, you almost feel like you're on an island by yourself. A lot of the people that you went to school with, a lot of the colleagues, you might be doing something a little bit different, or they don't understand what you're doing. But there's a certain energy when you get in a room where everybody is focused on one thing, and it's improving patient outcomes. Like, how well can we help people? And that's what that event's all about. And it's not things in theory. It's how do we leave this conference, and on Monday morning, we're applying things that help patients live a better quality of life and spend more time with their family and the people that they love. And so it's super energizing and exciting, and it's just a lot of fun. It's a bunch of friends just kind of hanging out.
Yeah, and a couple more, man. Whenever I'm out at conferences or out in the wild, so to speak, people ask me like, "Hey, where do I learn about peptides? Where do I learn about longevity?" And I usually refer them to the clinical longevity certification. Because there is, and I tell them it's like, yeah, you want to know more about peptides, but it's more than just peptides, right? It's peptides and longevity, and how do you optimize our health span, our lifespan, all these things here. And I direct them to that program. Can you tell us a little bit more, or tell us a little bit more about the clinical longevity certification?
Yeah, absolutely. We wanted to do something specifically on peptides because there's so much lack of information on peptides, but I think it's impossible to talk about peptide therapy or a class of medications by themselves. And so what we did was we created a certification course that was on longevity medicine and peptide therapy, because you cannot get the most out of peptides unless you are mixing them with exercise, unless you understand them deeply and understand how they go well with supplements or how they go with other repurposed compounds. And so we have, a longevity certification course that's really heavily focused on metabolic disease, especially cardiovascular, and peptides and longevity. And so we go over a lot of the things that we talked about today. And one of the things I think a lot about is I don't like creating courses because things always get better. New information always comes out. Right. The second you create something a year and a half later, you're like, oh, I know I can update this, or I know that there's an even better way to do this. And this is why I hate even helping formulate supplements, because my business partners hate me, because I'm just like a year and a half later, I'm like, hey, there's new data. We can make this a little bit better. We can make it more bioavailable. And so we're constantly changing things. And so when you're part of that longevity certification course, it's not a stagnant course, right? It is something where you can call and talk to a clinical pharmacist about what you're learning in that course, or what you're dealing with your patients. And we're constantly updating it. There's 2 new modules that we're filming now that we're going to update to that course, newer webinars. So it's an ongoing thing. It's not a static type of course. And so we're really passionate about that. And, we, it's hard. Sometimes my staff gets really upset with me. They're like, can you just stop? There's always a way to make a supplement better. There's always a way to make a course better. It's like, we're all addicted to continuous learning. And so,
oh no, exactly. Yeah, you have to update it. There's always new stuff coming out. There's changes to it, and this protocol is changing. So I definitely commend you guys for updating it. It's great. So last one, man, you made it to the home stretch here, man. You're here. We can see the finish line. You're almost at zone. You're almost at your VO2 max, man. We're going. We're almost there. I need a few more steps out of you, man. So for those listening that want to learn more about you and your journey and New BioAge and the clinical certifications and conferences you guys have coming up, where can we get more information?
Yeah, the easiest place is to go to newbioage.com, right? So it's NUBIOAGE, newbioage.com. And you can see anything from our entire ecosystem of how we help providers deliver longevity medicine, to our education, to the different innovative supplement formulations that we make. And that's how we kind of stay connected. I'm on Instagram. I'm at Leonard Pastrana, and that's where you can kind of keep up with everything that we're doing and everybody that we're partnering with. And we really enjoy the feedback. We really want to know, how we can help medical providers, and we understand that, our medical providers, their person is the consumer, and you guys are constantly trying to educate the consumer as well. So we're very much interested in how that conversation happens. So we're that's where you can find us, and that's where we can connect and do the things that we love to do.
All right. Well, hey, man, and just for those listening, I will put all that, the websites and the Instagram and all that in the show notes, so you'll be able to look at there and follow Leonard and New BioAge. And for the practitioners out there, I highly recommend you show up in Fort Lauderdale next year. It's gonna be a good times. Gonna be good times. I don't know what I'm talking about yet. Whatever you want, man. I got you. Yeah. Not
Boy,
sleep.
We got a lot.
Sleep.
We not sleep. We got a lot of work to do. I have some ideas. I have some ideas for you.
All right. Bring it on, man. Bring it on. At this point,
yeah.
I can remix some presentations, man. I can take some presentations, remix some acid and stuff, man. But I got some ideas too, man. I had this. Okay, I don't want to put myself in a box here, man. But I was thinking about, I've been doing more genetic testing. And I'm actually getting to a point now where I'm learning how to take some of those genetic variants and use peptides to address them. There's certain variants actually are connected with certain peptides, especially with some of the metabolic ones, some of the mitochondrial ones, some of the inflammatory ones. And I'm actually using the peptides to actually target that. So
I'm excited about that. That was one of the first things I did when I got into this space. Was I got really deep into genetic testing, and I saw, wow, there are so many places where we can get very personalized with peptides. And then we got so involved in everything else. So absolutely, that sounds like an awesome topic. I would love to have you to do that. That would be amazing. Finally, I got one. I know one of the talks is going to be.
You got one. I was thinking about it. Let me go ahead. Let me pitch this live, as we go. All right, man. I'm gonna let you get out of here. Dude, Leonard, I want to say thanks again for your time, man. It's always a pleasure talking to you, man. I'm glad we were able to get you back on the podcast because that's right. We did one and we were thinking about coming back and doing like we were talking about doing one of the newer GLP-1s, and we kind of like, no, we can't do that right
Oh,
now.
no.
So we
Friendly
backed off
fire.
of that. Yeah. No. So we backed off of that, man. And now we found a good topic, man. So I'm glad we got a chance to talk about it. And good, man. So I appreciate you, man. And I'm actually going to see you in a couple weeks at a
Mhm.
conference in New York. And then I'll see you in Florida, man. So or probably A4M probably too. You guys having a booth this year?
Yeah, for sure. We
All
always go
right.
out. We always go out in December to have fun.
Man, last year, for those who weren't there, I remember y'all giving out rollies, Louis bags. It was nuts. It was
Oh
crazy.
yeah, we almost caused a problem giving out Louis Vuitton bags. We did.
I was
It
like,
was
okay.
very very popular.
Oh, it was. It was. Everyone, and that's how you do it. But you probably got a lot of interest in the company, man. So I'm looking forward to seeing you guys again.
Yeah,
So,
it was fun. We love giving to them.
unfortunately, as a member of the clinical longevity team, I'm ineligible for the prizes.
Yeah,
That's okay. That's all right. You know what I'm saying?
yeah, we had a
I love
problem with that once. Someone got really mad at me.
It's like, how'd this person win? But anyway, it's rigged. But no,
Yeah.
man, I appreciate you, dude. Enjoy the rest of the week, man. I'm going to
Mm.
see you next week and we'll hang out, man, and keep learning. And that's it, man. So, all right, everybody, this is Dr. Greg Jones, the Optimization Academy. Another episode. Again, please follow New BioAge. Please follow Leonard. And we will see you next time. Let's keep educating. Let's keep learning. And let's keep getting optimized.